I was working in a foster family agency. I had my own son at that age. He had just been born, and so I was seeing newborns and infants coming into foster care, some of them with broken arms, broken legs, and it became very distressful. My drinking became more than just social. I would get home after a hard day, not being able to really talk about it because, one, I didn't want to add stress to the family. I decided, you know what, I'm just gonna drink.
It came to the point where I had been self-harming since the age of 12, and that was my first coping method. And then it was alcohol, and then it was drugs, and then it was getting suspended and getting in trouble at school.
I had to drink. It wasn't no longer about what I was hearing at work. I had to drink to feel normal, I guess you can say. I knew on some level that I was what we would say an alcoholic, but I didn't want to admit that to myself.
So it kept getting worse because I thought, the more I drank or the more that I avoided my problems, that I would be able to forget certain things and that I would be able to accept, the bad things that had happened in my life, but it didn't ever work that way.
I got to see the tremendous effect that my drinking had on my son. He drew this picture of what his life was like when Daddy was drinking. He had himself upstairs isolating, watching TV by himself, and me downstairs laid out on a couch with beer bottles or beer cans on the side. And I think about that. Sorry. And I didn't see it.
It just progressed until the point where I ended up in the hospital.
The last time I drank, I quit my job and I went to several liquor stores and I got pretty intoxicated. And I came to a stop sign, and at that point when I got to the stop sign, I realized that that I was in a fork in the road. I didn't even really recognize who I was. It was like, what have I become? I made a decision that I had to do something different, and I didn't know what to do. So I called one of my friends that I went through the master's program, who happened to be familiar with the BMC. I didn't know their number, and I called information, and they happened to have their number, So that night I got off the phone with this person, and for the first time I felt, my God, there might be something different. Because on a daily basis I'd wake up not liking myself, avoiding mirrors because I didn't want to see who was in the mirror.
I don't think that there was anything that made me want to go into treatment because I never thought that I had a problem. My mom wanted me to get better, and she didn't know what else to do. Everything that she had tried was just not working. So the BMC was kind of like our last hope.
I ended up going into the BMC as suggested, and I did whatever they told me to do. I left the comfort of my house. I left my family and my kids. For 51 days, I went into sober living. I was really done. I didn't want to drink anymore. I didn't want to feel like I did.
Arriving at the BMC was scary for me, and I was very angry. I was scared because I thought, what if I actually come out of here sober, And I always kind of thought, oh my gosh, AA, really for me, I'm only 15, why do I need this?
It is ironic. Because I was studying to become a therapist, wanting to help other people, and yet in reality it was things that I was struggling with.
I became glad to be there when I had gotten out of the hospital for alcohol poisoning, because after that I had started to take everything seriously, and I thought, maybe I do have a problem.
My recovery and my career are related. The BMC was the contributing factor to where I'm at today. I mean, I was so grateful that I started working for them as well,
Phil's story is a great example of someone who's gone through some difficulty and been able to receive treatment himself, and now is able to give back to a whole bunch of other new people in his life that he can impact through his experiences.
I started working for the BMC about 2 years into my recovery. Part of the recovery process is sharing your experience, strength, and hope.
I feel like it was really important for me to trust Phil, my therapist, because I had to tell him a lot of things that I had never told anybody before. He was able to tell me parts of his story, and I felt like it was important that I felt like he trusted me. So definitely being at the BMC and having Phil as my therapist got me through that.
It takes adolescents a long time to trust an adult, and a lot of times they think of us as being an extension of their parents or schools or the police, and it takes a long time to build rapport and a relationship with them.
I appreciate that he didn't just pretend that everything was fine in his life, and he was honest with me.
And so to be able to tell them, that I've experienced that and I've been there, they are more apt to understand that I know where they're coming from, because I'm not just another adult in the room, telling them, say no to drugs or drugs are bad or whatnot.
With the treatment that I got, I was able to open my mind more, and I had become more self-aware.
That's ultimately what I want to do, with anybody who walks through and is a patient or a family, is just, give them that sense of hope.
I would say the BMC changed my life, definitely, because I don't think that I would have even thought about becoming sober if I hadn't gone there. 2 years later, I probably would have still been doing drugs and alcohol, and I would have been in such a dark place. I might not even be alive without the BMC.
If I had not gotten sober, and if I was still in my disease, we wouldn't be talking right now. And I don't know where I would be. And I know probably I wouldn't have a relationship with my family. I know that for certain.
Becoming sober is one of the best choices I had ever made, because it's opened so many doors for me. I get to talk to people I don't even know and tell them my story, and hopefully I inspire at least one person to want to go into treatment.
It used to be, that any kind of emotional, whether it's happy, sad, resulted in drinking. And today I can do and experience those things and go through them sober. And I get to do it. Excuse me. And I get to show my kids that you could do it too.
I have become so much happier, and I'm more free, and I'm doing a lot better in school, and I'm making better friends. I'm incredibly grateful for the BMC.
When I spoke to that person the night that I called, and they knew exactly what I was experiencing, and I thought, if they can do it, maybe I can. And that's just giving back.
We often don't think of the small things that we do as having a large impact, but when you look at Phil's story, just that one phone call had such a dramatic effect in his life, and now he's able to pass on that to others. And
I call that person every year, same day, same time, and I tell them thank you. It'll be 7 years and 2 months, clean and sober, where I haven't had a drink. Or any other mind-altering chemicals, except for coffee. I'm grateful that there was a place that gave me my life back.